Leg length discrepancy is a condition in which one lower limb is noticeably shorter than the other. While minor differences in limb length are common and often go unnoticed, significant discrepancies can lead to discomfort, gait abnormalities, and long-term orthopedic complications. Leg length discrepancy is defined as a measurable difference in leg length. While complete bodily symmetry is rare, the textbook diagnostic standard is discrepancies exceeding 2 to 2.5 centimeters. However, the standard was established based on outdated data, and Dr. Lee believes that it should now be revised to approximately 1 to 1.5 centimeters. Also, some individuals with smaller discrepancies may still experience discomfort, highlighting the need for an individualized approach to diagnosis and treatment. A precise diagnosis is crucial, as many patients inaccurately perceive a difference in their leg length. Standard diagnostic methods include clinical examinations, radiographic imaging, such as EOS imaging. These assessments provide accurate data for determining the most appropriate course of treatment. Leg length discrepancy can arise from a variety of factors, but in many cases, there is no specific cause. Some of the most common causes include a condition in which one limb grows disproportionately longer than the other, which occurs without reason. In this case, patients are diagnosed at a young age and the difference becomes larger as they grow. Fractures or surgeries involving the growth plates during childhood can lead to overgrowth or stunted growth of the affected limb. This can cause the femoral head to not develop normally, which can impair normal hip joint development. Conditions such as congenital femoral deficiency and congenital pseudoarthrosis of the tibia. Certain bone tumors or systemic conditions affecting skeletal growth. Management of leg length discrepancy is determined by the severity of the discrepancy, the patient's symptoms, and overall functional impact. Treatment strategies generally fall into two categories: lengthening the shorter limb. Shoe inserts are a non-surgical approach that can compensate for minor discrepancies and alleviate symptoms. Limb lengthening surgery, a controlled procedure using external or internal fixation devices that gradually increase bone length over time. Shortening the longer limb. For patients with open growth plates, procedure can be done to delay the growth of the longer leg by holding the growth plate for a while. For adults, more complex surgical intervention that involves resecting a portion of the bone to equalize limb length. Treatment decisions should be guided by both accurate X-ray findings and the patient's subjective experience. Some individuals with a 1.5 centimeter discrepancy report significant discomfort, while others, though with the same 1.5 centimeter difference, adapt well without intervention. As a result, treatment plans should be highly personalized, incorporating both non-surgical and surgical options based on the patient's functional needs, symptoms, and lifestyle. In the next video, we'll go over treatment options for leg deformities. Thank you for watching.